When I got asked by CARE to attend and speak at today's luncheon, I thought, my gosh, where would I rather be than with 1,100 people that believe in the same thing I believe in? Bill and I are spending the last couple days and tomorrow too working the Hill as well, so I am excited to hear that there will be 1,100 of you there with us, because it is a tough time that we're in. And I have to say, that's where I want to start. You know, I love the idea that we're here together on the 100th anniversary of International Women's Day, but I wish it was in different times. We're in a difficult budget year, environment and year. And, you know, the lingering economic crisis that we all know about makes this a very painful budget season with hard trade-offs that are going to have to be made in this historic time. So our celebration today, and I really want it to be a celebration, I have to say, though, it's mixed a little bit with sympathy for those who we know are struggling, both here and the United States, and boy, oh boy, do you see it when you travel abroad right now. I think often when I get up in the morning about the families that I've met who don't have enough food to feed their children every day, and to think about what that's like to know that you're not sure you can feed your child by the end of the day. So our celebration is also mixed with a little bit of anxiety, because many of the programs that we so much count on for women and children depend on the survival of the government support in this budgetary cycle, and we're at risk of losing that support. So in this back and forth debate about the budget, you know, every imaginable interest group is up there on the Hill meeting with their representatives, as they should be. But when I think about the women in the developing world and where they have voice in the democratic process, they have voice through you all. You are the ones that have to be up there saying, this works, this matters, we've got to continue the work. You know, 100 years ago, on the first International Women's Day, women around the world marched, and they marched in the streets to demand things like a right to an education, a right to vote and hold office, and the right to fair and equal wages. Now, we celebrate those pioneers by remembering everything they accomplished so much, and we honor them really by carrying on the work that they started. Right now, carrying on their work means making the case for women and children's health. So as Helene said, I was recently in Kenya, and I was meeting with a group of mothers in the Korogocho slum outside of Nairobi. Now, this is an incredibly dusty place. The buses go by, there's lots of exhaust, there's no running water. Sometimes they can tap into the electricity. And the women find a little bit of work by finding somebody who might pass by that they can do their laundry or other things there on the city edge of Nairobi. And so when I sat to talk with the women, there was a mix of joy as they talked about their children, because they feel very joyful about being mothers. And it was also mixed with a lot of pain, because we were talking about the health of their family. And one woman said, I want to bring every good thing to one child that I have before I have another. And I thought, gosh, that is so beautiful, because it's hard to imagine what it's like to raise a child in Korogocho in those really horrific conditions. And especially when you know that your daughter's chances of dying are higher than her chances of being left-handed. One of the mothers I talked with had 4 daughters, and only 2 of them were around, one on her hip and one following behind, because just in the last couple of years, she'd lost her 2 older children. So there's not a soul on earth who doesn't know what that mother's talking about when she says, I want every good thing for my child. Mothers everywhere, every day, they work to bring every good thing to everyone, every child. And they work for hours and hours. If they're in the rural areas, they work in a field to tend their crop. They take care and nurse their children when they get sick, which happens a lot in the developing world because of the compromised immune system these children have. And these mothers save every penny to possibly pay those school fees and get their child into school. So we know mothers invest in life-saving health care and life-making education for their children. When the world also invests in these things, we're reducing the sorrows of motherhood. We're empowering women to create the future they want for themselves and for their sons and for their daughters. So an investment in women is an investment in children. And an investment in children is an investment in women. And so an investment in women and children is the future that we all share together. Now, as advocates, we have an amazing story to tell. It's the revolutionary story of child survival. And it goes like this. All you have to do is go back to 1960 and say how many children were dying every single year under the age of 5. It was 20 million children in 1960, right around the time, I hate to age much of myself, but right around the time that I was born. And then the world learned how to grow more food, treat more disease, and the number of children who died went down, way down. By 1975, the number of children under 5 who died was 15 million. That's a pretty amazing story. Then the world learned how to deliver more medicines and vaccines, and the number went down again to 12 million, then 10 million, and now last year we're down to 8.1 million children dying before their 5th birthday. So when we advocate, we have to remember to tell our story. We're not just haggling over a line item in a government budget. We're talking about a life, a child's precious life. What more could be important than that? We have this amazing story to tell, and here's the most fantastic part. We know exactly what to do next. Right now, at precisely this moment, there are proven and simple ways to save millions more children than we are doing right now. And so the question is not, can we save these precious lives? The question is, will we save these lives? Will the world hear our story? Will governments spend the relatively small amount of money it takes to strengthen families and to build thriving societies? We cut child mortality over the last 50 years in half. My question is, how long is it going to be before we have it yet again? Because we can do that, and it's not as difficult as some people think. One of the smartest investments we can make in women and children is vaccines. We know vaccines are a miracle. They're inexpensive, they're easy to deliver, and a few doses will protect a child from debilitating disease and sometimes a death for their lifetime. Now, vaccines are what made it possible to wipe smallpox off the face of this planet. We no longer have it. We no longer vaccinate for smallpox. Vaccines have also cut the number of polio cases down by 99% in just 20 years. We hardly think about polio in this country, but one generation ago, my mother's generation, her sister had polio. And believe me, this country thought about it a lot. We had a lot of children in iron lungs. So when you think about that progress, 99% progress in polio in 20 years, and you think we are on the brink, literally the brink, of eradicating polio off the face of the planet, just like smallpox. And if we do it, It's going to be thanks to the financial commitments of donors and governments and a very impressive logistical effort on the part of poor countries, and a 13-cent vaccine for a child. That's what it takes to wipe out polio. The other exciting thing to me in vaccines is that there used to be this very large lag. There was a 15 to 20-year lag between when a vaccine came out in our country or the developed world and when it got to the developing world. Well, that lag now is down to less than a year in many cases. Sometimes we're almost simultaneously launching a vaccine here and getting it out in the developing world. So if you can save the life of one child in our country with a vaccine, you can save the life of that child in any country with the vaccine. And the sooner we get it out there, the more lives we can save. Now, pneumonia is the biggest killer of children around the world, and I don't think people mostly realize that. But Guyana, Kenya, Sierra Leone, and Yemen have just introduced a brand new vaccine for pneumonia. The second biggest killer of children is diarrhea. Those 8.1 million deaths, a lot of them are pneumonia and diarrhea. Nicaragua recently introduced a new vaccine for diarrhea. So there's a good chance that just in a few years, vaccines will protect children in the world from the two biggest killers that we know of today. That is an amazing story about vaccines that we get to tell. Let me tell you another story. It's like that of vaccines, and it starts out sad, but it gets a lot better. In the first 28 days of life, babies are especially vulnerable. In poor countries, many of the complications that arise during childbirth can be fatal, and millions of newborns die because they're born premature, they can't breathe adequately, or often they get an infection very early. Now, we haven't always known how to prevent these deaths in this first 28 days. We know about vaccines from 28 days and beyond, and we can save lots of children with those. But this first 28 days for a long time was really one of the most frustrating puzzles in global health. And it was one of the most terrifying periods for a mother of her life. But that's changing, and it's changing really fast. A series of recent studies have proven beyond a shadow of a doubt that we can dramatically reduce the risk in the first few weeks of life for that newborn. For example, simply teaching a mother to hold the baby against her skin makes an enormous difference. It's called Kangaroo Care. We actually use it these days in the United States too, because it works. It helps regulate the temperature, heartbeat, and breathing of babies who are in distress. And it also helps promote breastfeeding, which is one of the most important things we can do to protect infants from infections. So that's how we get at the first 28 days. Now, can you believe that Kangaroo Care can save the life of a newborn and some of these preterm infants who are currently dying? It's that simple. So it's not technologically complicated to save a newborn, but we're learning how to deliver these simple tools and these messages in a culturally appropriate way so that women will uptake these two practices and save their baby's life. We have an amazing story to tell. Now, there's one more proven way to save a huge, huge number of lives, and that's giving mothers and fathers the ability to decide how many children they will have and when they will have them. I think as a woman in the United States, when I got married, I took for granted my right to have a contraceptive tool. But when we were ready to have children and we knew we could have them, we planned. We were able, as a couple, to plan the timing and the spacing of our children. For women in poor countries, where it's hard to get food and clean water or basic health care, it can be even more important that they are able to plan and space their children. I met another young woman in Korogocho when I was there, and she had a business making and selling these backpacks out of blue jean fabric. And she invited me into her home, and I was talking with her about the 2 children that she had that were several years apart. And as we got talking about health care in her home and where she was getting water and how these children were surviving, we started to talk about contraception. And I said to her, why do you use it? And she said, because life here is tough. And when you talk to the women in Korogocho, they talk a lot about, do their husbands know they're using family planning or do they not? And so when I talked to her a little bit more about contraception, I said, does your husband know that you use it? She said, absolutely. He knows here that life is tough, and we have to be able to feed our 2 children. So when life is tough, your best chance to make life better for yourself and for your children is to have some control on how you grow your family. Now, in this country, there's a lot of controversy about reproductive health because of the issue of abortion. And I understand that. It's appropriate to continue having those discussions here. And there are strong feelings on both sides of that issue. But the thing we need to remember is that there has long been broad consensus around the need to give women access to contraceptives. Contraceptives that women in this country have access to every single day when they go to the drugstore. It is vital to maintain that consensus, that peace that we already agree to. Because right now, there are 200 million women in the developing world who want access to a contraceptive tool or device so that they can plan their family. When I think of these 200 million women, I think this is a problem we can solve, and we should be able to solve it. I believe in people's good faith, and I'm optimistic we can work together to give these women the life-saving tools that they deserve. When I meet women in poor countries, contraceptives are one of the things they talk to me about what they want the most. And in fact, if you talk to women about contraceptives, they are amazingly well educated about what has been in their country and what they've had access to before and what they don't currently have access to. And they say, why was it that 5 months ago I could get that shot or I could get that particular tool and I can't have it anymore? What am I supposed to do? So there are excellent contraceptive tools available today. There are condoms. There's an injection now that costs $1 every 3 months. There's also a tiny little implant of 2 rods that goes in a woman's arm that costs $8 and it lasts 4 years. So $2 a year so she can plan her family. I observed a woman getting one of these implants, again, outside of Korogocho, and it took a matter of about 6 minutes. It was basically painless. I hope it was painless. She said it was. They put a Band-Aid on top of it when it was over. And she said, you know, I get to plan my family now. It changes the future for her family about her ability to feed and educate her children. So when we get to contraceptives to all the women that ask for them, I think we're going to have another amazing story to tell. So I've seen all of these approaches work: vaccination, newborn care, contraceptive. But last year, I also got to visit Malawi, and it's one of the poorest countries in the world. It's a place I hadn't yet been to in Africa. But Malawi has visionary leaders, and it's built a very strong healthcare system around 10,000 frontline workers. They call them in their country health surveillance assistants. And most of these assistants that go out in these rural communities, they're women. They spend about 1 week a month in the healthcare facility, which is a tiny little facility. It's, maybe a third the size of this stage. And then they go out and spend 3 weeks in the rural community, amongst the people, and they make sure that they give the life-saving tools and messages to women, and they get the women into the healthcare facility. Because of these health surveillance assistants, these women, and the work that they're doing, in Malawi, vaccination is up, newborn deaths are down, and family planning is more readily available. Malawi, one of the poorest places on earth, is on track to meet Millennium Development Goal number 4, which is to reduce childhood mortality by 2/3. They're making so much success against Millennium Development Goal 4, they're now tackling Millennium Development Goal 5, which is to reduce the maternal mortality ratio by 3/4. When you come out of a place like Malawi, you say, if this can be done in Malawi, this can be done anywhere in the world. It is totally and completely possible. And it is being done around the world. India is deploying frontline workers, hundreds of thousands of them. So is Pakistan, so is Ethiopia, and they're doing it at huge scale. There are now millions of health workers, mostly women, on the front lines in countries around the world. And as long as we give them the proper equipment and the proper training, they will have an amazing story to tell in their own country. One of the reasons I went to Kenya recently was because I wanted to learn about the pneumococcus, or the pneumonia vaccine that's just coming out. And I wanted to see what an introduction of a new vaccine looks like in a country like Kenya, because we're going to do this all over the world. So I started at a hospital that looked like most hospitals in the developing world. It was crowded, very crowded. There were 4 children to a bed, and half of the children were suffering from pneumonia. And this was a hospital where they had not yet introduced the pneumonia vaccine, and so they were taking cases in of children with pneumonia. And a doctor showed me into what they called an intensive care unit. And it was really hard to watch a child struggling for his breath. Children like that are fighting for their life every time they inhale. And I had a really hard time in the intensive care unit looking into the mother's eyes, because she knew her child was fighting for his life and was unlikely to see out the day. And in this intensive care unit, they had 1 tank of oxygen, and they had 4 children that needed it. So they'd taken some urinary catheter tubes and strung them up to this tank of oxygen, and they had 4 children off of this 1 tank. It wasn't the ideal delivery mechanism, but it was better than any other alternative. It's really hard to see kids in that setting, because the mothers' hearts are breaking. And when you go there, I have nothing I can offer those mothers, nothing in that situation. But then I went to a different facility. It was the Westlands Clinic, also in Kenya, not far away. And I sat with a young mother while her child was getting one of the very first pneumonia shots in the country of Kenya. And it was a joy to talk to this woman. And I often like to ask the mothers when I sit down with them, what do they dream for their children? What are their plans? And you hear the same thing, this resounding theme that comes up. They want to be able to feed their children, and they want to send them to school. And they know if they can raise a healthy child and get them into school, they'll change the trajectory of that child's life and their family's life. And the pneumonia vaccine gives them a chance to live that dream. So for a child, getting a pneumonia vaccine is not the most pleasant experience. It's a jab in the leg, and they cry for a few minutes. But to a mother, it's the difference between a vigil over your dying baby or the chance of the beauty of a lifetime. So we have an amazing story to tell, and I urge you to go tell it, and tell it over and over and over again. Donors and governments need to hear the real story. They need to hear the stories of these women and children who are alive because of our aid. They need to hear the stories of the frontline workers who are bringing good health in far remote villages in some of the most rural places in Africa. They need to hear the stories of mothers who can provide for their families because those mothers are able to plan for those families. And I think most importantly, they need to know that they've already been part of a movement to save millions upon millions of children's lives. They've already made women's lives healthier and happier. That's already happening. And they need to know that there are proven and simple ways to build on the progress that has already been made. So let us celebrate International Women's Day by telling our story. Let us make people hear our story, because we all have an amazing story to tell. Thank you.